Hello everybody, my name is James and in this video I will be discussing hyperthyroidism, which is like having a tiny but completely uncontrollable superpower inside your neck, producing too much hormones and turning you into a jittery, sweaty, and constantly hungry superhero. But first, let's take a look at the medical mnemonic for the differential diagnosis of hyperthyroidism. Graves' disease, also known as toxic diffuse goiter. There is the formation of autoantibodies against TSH receptors that causes the thyroid gland to hyperfunction. Graves' eye disease may present with or without hyperthyroidism and may be unilateral. Among the symptoms that may be encountered includes sweating excessively, heat intolerance, emotionally very liable. There can be redness of the palms. The skin is usually very moist and velvety and thin. There is a risk for thrombosis, tachycardia, and palpitations, among other arrhythmias. Patients find it very difficult to sleep and are very, very irritable. There is pretibial myxedema and Graves' myopathy, which leads to muscle weakness. There is weight loss despite appetite increase, menstrual abnormalities, osteoporosis. Regarding Graves' orbitopathy, there may be eyelid retraction, exophthalmos, proptosis, double vision. So these are some of the symptoms that may be seen in Graves' disease. The investigations would need a thyroid function test where we would see that the TSH is suppressed, but then there is an increase in the free T4 as well as the free T3. Radioactive iodine uptake would be increased in Graves' disease. The TSH receptor antibodies would also be positive. An ultrasound will help if there is any thyroid nodule and to exclude any malignancy. Ovarian tumors, tumor ovaria, is a rare type of ovarian tumor which is made up of greater than 50% of thyroid tissues that may be functional. In general, they are derived from all three germ cell layers and may contain tissues like bones, teeth, hair, nails. So here you would like to have a thyroid function test. The TSH would suppress and the free T4 would be elevated as well as the T3s. An ultrasound of the pelvic will do, an MRI would even be perfect. An ultrasound of the thyroid gland would also be important, and a radioactive iodine uptake test of the pelvic would also suffice. Iodine. The excessive ingestion of iodine can lead to either an iodine-induced hyperthyroidism or hypothyroidism. It often gets very confusing for students. Let's take some brief moment to describe that. In figure 1, what I have is a phenomenon by Judd Baisdell, and we will consider figure 1 as a thyroid gland of an individual that lives in an endemic goiter zone where there is less iodine, and this individual moves to another part of the world where there is abundance of iodine. So if this person consumes a lot of iodine, then the iodides would come excessively into the follicular cell. There's going to be a lot of iodides here in the cell. That is going to act on the thyroperoxidase enzyme, which would obviously increase or catalyze the reaction or the conversion of iodides into iodine. So there is a goal for the iodines. There is more iodine entering the colloids. So there is formation of thyroid hormones. So Joel Bezos' phenomenon is simply saying that if you consume a lot of iodine, that can lead to an iodine-induced hyperthyroidism, which is actual for our topic because we are discussing hyperthyroidism. Now, in contrast to the picture in figure 2, this is the Wolff-Chaikoff effect. And what this says is that in a normal thyroid gland, if you consume a lot of iodine, the iodides will come into the follicular cell. It will overwhelm the follicular cells with iodides, and that in fact would inhibit the thyroperoxidase enzyme. This is very, very important. Now, since the thyroid peroxidase enzyme is inhibited, the process of conversion of iodide into iodine is also halted or inhibited. So there is less iodine going into the colloids, and there is going to be less formation of thyroid hormones. Now, this will continue for a couple of days, maybe 10 or 14 days, and the thyroid gland can actually bounce back to its homeostatic balance by escaping from the Wolff-Chaikoff effect. And how does it do that? There is going to be a low expression of these receptors called the sodium iodide symporter. Now, that low expression means that there is going to be less of those receptors being synthesized in the membrane. And that's going to lead to less iodine coming into the follicular compartment. So what Wolff-Chaikoff is saying is that if there is excessive iodine, it can initially lead to low production of hormones, but eventually the thyroid gland bounces back to a euthyroid or a normal production state. Plummer's effect is very similar to what Wolff-Chaikoff is saying, but it's a little bit different in the sense that it actually deals with preformed hormones. The hormones that are already formed in the thyroid follicular compartment is what Plummer is talking about. Now, he says that if there is a lot of iodine coming into the follicular cells, then that lot of iodines is going to halt or inhibit the proteolysis of the vesicles that contains the preformed T3 and T4, because the proteolytic enzymes have to work on these vesicles so that they can then diffuse into the vascular compartment. So Plummer's effect would also lead to less hormones coming into the blood after excessive ingestion of iodine. Trophoblastic tumors are neoplasias that arises from abnormal growth of placental trophoblastic germ cells, such as in hydatidiform mole or choriocarcinoma, where there is a production of human chorionic gonadotropins that has enough similarity with TSH. So what we are saying is that we have TSH, and TSH has enough similarities with human chorionic gonadotropins that excessive amount of human chorionic gonadotropins can actually stimulate the TSH receptors and lead to release of thyroid hormones, although this is very rare. Tshoma, pituitary gland tumor that secretes TSH and leads to the secondary formation of hyperthyroidism. It must, however, be differentiated from thyroid hormone resistance. How do you discriminate between the two? Well, let's take a look. So in Tshoma, there are two groups of cell. One group makes TSH as well as the alpha glycoprotein subunits. Then the other group of cells also makes only the alpha glycoprotein subunits. All right, so this is what happens, but it seems that in Tshoma, this group of cell here on the second line makes a lot of the alpha glycoprotein subunits. So in Tshoma, this will be elevated in contrast to thyroid hormone resistance. Then we can think of the molar ratio of the alpha glycoprotein subunit to the intact TSH. And since in Tshoma there is a lot of this ratio is going to be greater than 1, and it is usually less than 1 in thyroid hormone resistance. Moreover, you can think of things like imaging, because Tshoma is a tumor, so an MRI might identify a tumor in the brain, for example. But thyroid hormone resistance has a genetic background with an autosomal dominant inheritance. Sex-binding globulins will be elevated for Tshoma, and it's important to also note that administration of thyroid-releasing hormones will lead to a no increase in the thyroid hormones for Tshoma. Thyroiditis, and this can easily be memorized using the mnemonic R shape like relationship. Riedl's thyroiditis, also known as invasive fibrous thyroiditis, occurs when the gland is replaced with fibrous connective tissues. These fibroses may even extend into the retroperitoneum as well as the mediastinum. It renders the thyroid gland incompetent and presents as hypothyroidism. Subacute thyroiditis also occurs after sustaining viral infections. Patients usually complain of pain in the neck with or without fever. There may also be an elevated ESR with leukocytosis, but the radioactive iodine uptake is decreased. This often presents as hyperthyroidism. Hashimoto or chronic lymphocytic thyroiditis is an autoimmune thyroiditis that presents as hypothyroidism with an elevated thyroid peroxidase antibodies. Infectious acute separative thyroiditis is an endocrinological emergency usually caused by pyogenic organisms secondary to systemic infections. It might cause thyroid storm, an emergency that needs urgent attention. Painless or silent or postpartum thyroiditis affects women in the postpartum period and is known to be very recurrent. The ESR is usually normal compared to subacute thyroiditis, and there is a longer hypothyroid phase which is preceded by a transient hyperthyroid phase. Adenoma can be benign but very hot. In other words, they produce excessive thyroid hormones. They can be in the form of a single toxic or a toxic multinodular adenoma. Some of the red flag signs that will be suggestive of a malignancy could include a firm, non-tender nodule with a normal thyroid function test. Cancer cells almost rarely produces thyroid hormones. Calcifications may also be suggestive of a papillary thyroid cancer, which is a picture of something called Tshoma. Dense thyroid could sometimes imply medullary thyroid carcinoma. Radioactive iodine will be elevated for these toxic adenomas. So there's going to be an increase in the radioactive iodine uptake. Thyroid ultrasound is very vital in the evaluation because you'll be able to assess the nodule properly. And in order to exclude Graves' disease, you might like to check the TSH receptor antibodies. Now, antithyroid peroxidase and antithyroglobulin antibodies are non-specific. Thyroglobulin would usually be elevated in cancer and decreased in a factitious disorder. Role playing, factitious disorder. Now, this is where one assumes the role of a sick person, and it's not necessarily to have a physical gain, other than what they might consider as a psychological gain. So, this can occur through the surreptitious consumption of exogenous thyroid hormones and can lead to signs and symptoms of hyperthyroidism. If you suspect a role play or a factitious disorder, you would like to look for the thyroglobulin levels. And the thyroglobulin levels would usually be decreased in such instances. So drugs such as amiodarone and other contrast-containing agents may be rich in iodine and cause both hyperthyroidism as well as hypothyroidism. You may use the knowledge you have acquired from the phenomenon of Jod-Basedow, the Wolff-Chaikov's effect, and Plummer's effect to have a better understanding of this. Thank you for watching, and if you find the content useful, then subscribe to the channel. Bye.